All right, so lockdowns are very much a part of today's news. Are they going to be reimposed? Well, during the first round of state-imposed lockdowns, no car company launched a more public fight to reopen than Tesla. Now, well, as you can see, the stock has now recovered and is up about 75% since the first confirmed U.S. COVID case back in January. CEO Elon Musk was so frustrated that he threatened to move his electric vehicle plant out of California because California was dragging its feet on letting him reopen. Well, we now have visuals of the dramatic production freeze that Tesla endured. RS Metrics is a company that takes satellite and drone imagery to help institutional investors see how busy a company's operations are. So what you're looking at on the left is January 14th. This is the employee parking lot at Tesla's Fremont plant. You see all the red? Those are employee cars. Nearly 3,700 cars captured pre-outbreak. Then in March, that's the middle one, it drops to 799 cars. But by April, that's the far right one, down to just 480 cars. But images of Tesla's finished car lot, where they put all the new cars, are even more stunning. Mid-January, this is on the left, a booming 779 new cars were ready to go. That number fell to, by March, about 250 cars, and by April, a stunning plummet to just 159 new Teslas in that lot. Tom Diamond is the president of RS Metrics, the company behind those images, and behind some new alarming ones from Wuhan, which appear to show the virus outbreak started kind of well before China said it did. Tom, let's start with the Wuhan images, and we'll get to Tesla in a second. Sure. What have your images turned up, and what are you deducing from those images now?
Well, RS Metrics has measured hospital traffic for almost 10 years. A lot of it's for hedge funds looking at HCA or Tenet in the U.S. and using that to forecast stock price. We also do hospital traffic for epidemiology and virology, and did studies in Latin America, Mexico, Chile, Argentina, and see the hospital traffic trends rise right before outbreaks. Mm-hmm. And in Wuhan, we saw something similar using the same global methodology that we use. We look at hospitals all over the world, and we have for a long, long time. And in Wuhan, it wasn't a surprise. Just before, the public really knew that, or released the official numbers, hospitals were already filling up, and we see that everywhere. If you look, one of the images that I think you're showing is October 2018 of the hospitals, okay. And if you flip to the next one, you can see an increase in cars there.
Okay, hold on. That's 2018. So you can see it's kind of sparse. And now, please, let's flip to 2019 of the exact same lot. And this is Wuhan Hospital. And it's starting to fill up. This is October.
Yeah. And, if you look at a time series chart of that hospitals and others there, the 6 total that we looked at, they follow a similar pattern. And it's something that we've seen for, a lot of the other locations that we've seen before. So, again, it wasn't too surprising to us, but, to others that, it looks like it did start a little earlier than people thought. And, now that we're
China, let me just interrupt you here. Let me just say that China had indicated that it began in December, but you've got another hospital here, the Zhonggang Hospital of Wuhan University, and that's showing the same thing, 2018. And then we can flip over to the Zhonggang Hospital from 2019, and it's starting to fill up. But again, this is October. So they kind of must have seen something, right?
Yes. And, just to be fair to everybody, even in the U.S., where there's a lot of data and sharing of information, there still is a delay before hospital traffic fills up and people realize that there's some kind of a health issue. It doesn't have to be a virus, it can be anything. And the reason is, the number of cases at a hospital is different than the number of cars in the parking lot. Cars in the parking lot is activity. There's doctors and nurses and emergency vehicles and patients, and that is really what is the signal ahead of these outbreaks.
All right. You're also tracking some medical centers in Arizona. Now, tell us what we're going to see here when it comes to the Arizona hospital.
So I think the 2 examples that you have there are Valleywise and Banner Thunderbird. They're 2 bigger hospitals in Maricopa County, which has most of the COVID cases right now. And it's just another example, exact same methodology. We just track the number of vehicles at these hospitals. The increases you're seeing there, if you're looking at the images that we're showing here, are all from this year. In Arizona, the most recent outbreak really happened at the end of May and early June. And I think, I don't see it right now, but I think one of the images is from April this year and the other is from June this year.
Yeah.
And you can see it's about a 20% increase in cars there. Yep. And just the one thing
I see that.
Yeah, the other one, Banner Thunderbird, very similar. And we see the same thing at the other area hospitals there. Also in Washington State, we have data on the VA Puget Sound Hospital, which is also showing an increase and did, kind of before everybody knew that things were happening in Washington. So it's just the point is, though, at one hospital, this is maybe not such a signal, but when you start to see 20 hospitals around you all showing 15, 20, 30% growth, then it's an obvious trend.
Yeah. I want to just get to Tesla before we go.
Sure.
The Tesla new cars, that lot, those pictures were really stunning to me because you start to see an almost immediate emptying out because they had transported out the new ones and there were no assembly lines working. And so we can show you those, and they begin, as I have my papers here, we start to see the actual production in January, where it was pretty jam-packed on the far left. There it is.
Yep.
Look at all those yellow dots. Those are brand new cars. Then it really goes down to just from 779 new ones to 159. We had a drone that went over a lot in Teslas, a lot of Teslas in this unmarked area in Long Island. What do you glean from a parking lot?
Well, Ars Metrics has measured Tesla's Fremont plant since about, I think, 2014 or 15, when it first ramped up and took over from Toyota. And in the early days, the question about Tesla was, number one, is there demand? And number two, can they meet the demand with production and deliveries? And that is why we did a lot of work around Tesla for hedge funds and others. That slowed down for us because last year, Tesla started doing better with their production. They beat estimates fourth quarter last year. But COVID has started it all up again. And now the issue is, can they meet their production targets again and deliveries? And, a parking lot, we not only, the images you see there, all the yellow cars are mixed together, but we actually differentiate the Model S, X, 3, Y, and, show those individually as well. And you can see.
You can even do that.
Yeah. And what you see is all the data that Ars Metrics provides, it provides a signal. You can use it to try to forecast an exact number, but it's more about a signal about where it's headed. And so, for a long time, this has been, a big piece of how people look at Tesla when they're investing. And you can just imagine, Elon Musk, seeing his factory drop down like this after working so hard, and that explains some of the frustration.
Yeah. Yeah, but quite a tool that Ars Metrics offers for certainly institutional investors and regular investors as well. Thank you so much. It's great to see you, Tom.